we've done great with improving median survival for metastatic advanced melanoma. Unfortunately, if you look at the 10-year data, there are about 60% of patients who are not benefiting with long-term survival. So we need to find the answers. Predictive and prognostic markers on who responds to what's the best regimen to start them off. And that comes from neoadjuvant studies where you can really understand response, have tissue pre and post, and find those biomarkers. What about those who have exhausted checkpoint inhibition? Well, adoptive T-cell therapies, novel bispecifics can work to increase survival, can work to reignite the immune system. One such therapy is the Replimune RP1 drug, which is showing good response rates and durability in patients who have failed PD-1, CTLA-4, and targeted agents. So that's an oncolytic that's going directly into viscera. But there's a whole host of novel medications that are being looked at clinical trials, that are being presented at ASCO, that are interesting and wonderful. NK cell checkpoint inhibitors, okay, that reignite the NK cell post failure of other checkpoints. There are novel anti-CTLA-4 agents that are being presented here. One is a BioNTech anti-CTLA-4 that is conditionally active, so it binds closer to the tumor and is not active outside, so possibly less toxicity, being able to get higher doses of drug, and so on and so on. Novel TIL therapies, like the Obsidian drug that's being shown here, are working to make adoptive T-cell therapy more generalizable to our population. How? Less induction chemotherapy, obviate the need for surgery by getting tumor tissue through core biopsies, looking at obviating the need for hospitalization for high-dose IL-2 and using a drug-responsive domain that expresses interleukin-15. So there's a lot here. I think this ASCO is showing us options for patients who failed initial therapy, and then decreasing the amount of therapy we need to give to these patients to decrease toxicity, whether financial or patient, and also neoadjuvant, adjuvant regimens to identify the right first step in their care.